We are now talking about the role of MSG in chronic diseases. Hello, welcome back to part 2 of the video about MSG. In part 1, we discussed the issues of public's fear on MSG. If you have not watched it, and wish to do so, please follow the link provided. Now, if you agree that MSG is safe for human consumption, then it's now more sensible to talk about its medical benefits to mankind in chronic disease management. Perhaps, to take a look at the video link below, if you still have doubt on MSG's safety for human consumption. In the previous episode, we talked about chronic conditions like hypertension, dementia, and sarcopenia in elderly. The race of cure to such diseases has never been ended, and perhaps hope is on the way if you look at different angles in terms of available remedy that is not just very safe, but beneficial in alleviating the disease burden to both patients and their caretakers. Modern medicine has yet found the cure to these chronic diseases, and symptom control is what we have at this point of time. Though scientists have yet to find the definitive answer to cure, the preliminary results suggested that MSG could be the solution to easing personal and societal burdens due to the chronic nature of these conditions. Everyone knows what is hypertension. It's a state of consistently elevated blood pressure above acceptable healthy levels. It's part of the popular 3 high, commonly cited by most elderly in the community, namely, hypertension, hyperlipidemia, and diabetes. For those who are not aware of dementia and sarcopenia, perhaps it's wise to learn now. Dementia, by definition, is a slow-developing, subtle syndrome that has negative impact on memory, cognition, social and personal skills, worst scenario, personality, and behavioral changes. It also alters sleep pattern. It often results in profound caregiver's distress and disrupted family dynamics. Sarcopenia, on the other hand, is more physically related, with severe loss of muscle mass, disproportionate to the norm, in terms of age. The condition has a negative impact on gait and stability in daily routine, increasing fall risk. The etiology of sarcopenia is generally multifactorial, namely low physical activity, reduced nutrition, inflammation state, age-related mitochondria, and neuromuscular degeneration, last but not least, apoptosis, and angiotensin system defect. Fortunately, some of these causative factors are modifiable, though not all. So, how exactly MSG benefits those with above chronic conditions? It turns out that dementia is epidemiologically linked to diet, such as excess sugar intake, with underlying insulin resistance. Well, you better know sugar in coffee next time. A study conducted by Japanese scientists showed that as little as 1 gram per day of MSG has a significant boost on cognitive score of tested subjects, in particular 2 parameters, namely word recognition and clock time recognition. Adding MSG to enhance umami taste in food helps alleviate appetite loss, which is a risk factor for dementia. Improved appetite for those with coexisting sarcopenia means enhanced oral protein intake, hence fighting against malnutrition and sarcopenia in elderly. Increasing age is also a risk factor for sense of taste loss and saliva secretion impairment among elderly, contributing to appetite loss and difficulty swallowing. Umami-producing MSG makes foods more palatable and enjoyable, meaning improved appetite, hence regulating weight gain in those underweight. We learned that excess sugar intake is unhealthy, so does high intake of salt. The elderly are vulnerable to negative body salt regulation, meaning higher tendency to develop hypertension in the state of constant high salt intake. Salt in foods, just like MSG, enhances palatability, but at the expense of increased cardiovascular health risk. Then, what is the remedy to cut salt in diet, yet without losing its flavoring and palatability? It turns out that the secret is umami. To create equivalent food palatability, umami-eliciting MSG helps to reduce salt intake up to 50%. In the long term, this has a profound health impact on hypertension control and associated cardiovascular risk reduction. See, umami is not just a more healthy choice of flavor enhancer than salt, it saves one life too. So, MSG is an option for salt replacement. MSG has only 1/3 of sodium, compared to equivalent table salt, cutting down the salt intake, without sacrificing the food flavor. In 1987, the conclusion was made, by the Joint Expert Committee on Food Additives, of the United Nations, Food and Agriculture Organization, and the World Health Organization, that there was no upper limit of consumption for MSG, making it the safest food additives in the history. Now, if you agree that MSG benefits those with chronic diseases, promoting their health as a whole, why not leave a comment and subscribe to the channel? We are happy to hear from you. The takeaways message. There is no solid scientific evidence that MSG is bad for human health, but there is an increasing amount of medical evidence to support its benefits in health enhancement. Until then, see you soon.